Hi friends, now I am going to discuss about otogenic brain abscess. It mostly affects the age group between 10 to 30 years and mostly men. Etiology, ear disease. In children, it is due to acute otitis media. In case of adults, it is due to CSOM. Stages of the development of abscess. Stage of invasion. Here, the symptoms are slight, and then next stage is stage of localization. Nature tries to localize the pus by capsule. Here there are no symptoms. Then stage of enlargement or manifest abscess. Here the abscess enlarges and there is a zone of edema around the abscess which causes increase in intracranial pressure. Then the stage of termination. Here there is rupture of abscess into ventricle and subarachnoid space. Clinical features. Clinical features are due to increase in intracranial pressure and the area of the brain affected. Now coming to clinical features due to increase in intracranial pressure. Headache. It is generalized and worst in morning in temporal lobe abscess. In cerebellar lobe abscess, it is in suboccipital region and there is neck rigidity. Vomiting. It is more common in cerebellar lobe abscess. Papilloedema, drowsiness, confusion, irritability and coma. Based on area of brain affected, temporal lobe is mostly affected compared to cerebellar lobe. In case of temporal lobe, route of infection is through Trotman's triangle, sigmoid sinus and labyrinthitis. Trotman's triangle is surrounded superiorly by superior petrosal sinus, anteriorly by semicircular canals and posteriorly by sigmoid sinus. And route of infection in cerebellar lobe is through roof of the middle ear. Sigmoid sinus thrombosis is very rare. Clinical features of temporal lobe abscess are homonymous hemianopia. Here the visual field is lost on opposite side of the lesion. Nominal aphasia. If dominant sphere is involved, the patient is unable to tell the names of the common objects like key, pen, paper. Contralateral motor paralysis, hemiplegia and epileptic fits. In case of contralateral motor paralysis, there is upward spread and inward spread. In case of upward spread, first the face is involved and from there add arm to legs. In case of inward spread, arms and legs are involved and then to face. Coming to cerebellar lobe abscess, there is ipsilateral hypotonia, ipsilateral ataxia and ipsilateral weakness. Nystagmus. It is very strong and moves to affected side compared to labyrinthitis. Dysdiadochokinesia. On rapid pronation and supination of the forearm, it shows slow and irregular movements on affected side. Positive Romberg's test. If there is a problem with proprioception, a person can maintain the balance with vestibular function and vision. In positive Romberg's test, the patient is asked to stand closing his eyes. A loss of balance is interpreted as Romberg's test. It indicates loss of proprioception. Coming to the investigations. Complete blood picture. There is increase in ESR and increased polymorpholeukocytes. X-ray skull. It shows midline shift if pineal gland is calcified. CT scan shows intracranial shifts. Arteriography. It shows intracerebral shifts, avascular areas and highly vascular areas. Coming to treatment. Medical and surgical. Medical, high doses of antibiotics and treating the cause of the ear infection. Surgical, draining of the abscess and removal of the abscess by excision by craniotomy. cortical or modified radical mastoidectomy. Thank you.